So the overview for today is we're going to talk about, just welcome everyone, introductions. And Dr. Obadan-Udoh is going to give an overview of the program. And then you'll hear from our panel of alumni and current residents on what it is to be a dental public health specialist. And then we'll go through the application process. And then we thank you so much for submitting your questions. We have plenty of time and we can always answer more after. So thank you for your participation, and then closing remarks. So Dr. Obadan, and this is our panel. So with our introductions, we'll go around and starting with Dr. Obadan-Udoh.
Thanks, Katie. Hi, everyone. Welcome. Welcome to our first info session for the UCSF Dental Public Health postgraduate program. My name is Eni Obadan-Udoh, and I'm the program director. What else am I supposed to say, actually?
Your focus and your interest.
Oh, right. Yeah. So I do a lot of work on quality improvement and patient safety. I also work on improving access to care for vulnerable and underserved populations. All right.
All right. Thank you.
Bahar.
Hello, everyone. I'm Bahar Amanzadeh. I wear different hats. As part of my work, I work at COTAC at UCSF, which is a Center for Oral Health Technical Assistance to the local jurisdictions and the counties. And I'm also an independent consultant. And I work with different government organizations in program planning and evaluation, as well as kind of establishing special programs around school oral health programs and care coordination.
Great. Thank you, Dr. Amanzadeh. Next, we have Dr. Bhavana.
Hello, everyone. I'm Sepide Bonava. It's an honor to be here. I'm really happy to be here today. I'm a dentist and a specialist in restorative dentistry and dental materials, and I graduated from UCSF DPH program in 2019. And since then, I started my postdoc at UCSF. So currently I'm a postdoc, and I'm also a volunteer consultant at San Francisco Department of Public Health Cavity-Free SF plan. And that's it. Thank you.
Thank you. Dr. Raju.
Hello, everyone. I'm Karen Raju. I graduated from UCSF Dental Public Health Residency Program in 2020. So you can call me a pandemic graduate. And currently I'm working with San Francisco Oral Health Coalition. And my career focus and research interests revolve around conducting a needs assessment, planning, managing, and implementation of oral health programs for perinatal and special needs population. And I'm glad to be here and excited to interact with you. Thank you.
Great, thank you. Dr. Patel.
Hi, everyone. My name is Prashanta. I'm a very recent graduate of a dental public health program, and I was first among the cohort of HRSA grant trainee. And my primary interest is to work with community clinics and local health department.
Thank you. And Dr. Magali.
Hi, everyone. I'm Haya Magali. I'm a dentist from Egypt, and I'm a current resident, expected graduation this year, next year. And my career interest, I didn't decide yet, but I know that I'm so interested in community programs that has health equity in the focus of it.
Great, thank you. As you can see from our alumni, we have a full range. So please ask your questions when we get there. So we'd like to ask all of you a question. Why are you interested in the dental public health specialty? So if you can go ahead and you can just type your answer in the chat. We just kind of like to hear a little bit more from you and who's here today. So as you guys are chatting in your replies here, I'm going to go ahead and we're going to do a more of an overview of the dental public health program and dental public health as a specialty. So for this, Dr. Obadan-Udoh, would you like to take over?
Sure, thanks, Katie. All right, so I decided to start with a little brief introduction about public health in general and the dental public health specialty. This wheel is really just a reflection of the essential public health services. And if you've done an MPH, you probably have come across this wheel. And there are three core functions. The first of which is assessment, assurance, and policy development. For each of the 10 functions, the first one is trying to monitor the health status to identify and solve community health problems. The second thing is to diagnose and investigate health problems and health hazards in the community. The third thing is to inform, educate, and empower people about health issues. The fourth is to mobilize community partnerships to identify and solve health problems. The fifth is to develop policies and plans to support individual and community health efforts. And then there's also enforcing laws and regulations to protect health and ensure safety. As public health people, we also try to link people to needed personal health services and assure the provision of healthcare when unavailable. And then number 8 is to assure a competent public and personal healthcare workforce. Number 9 is to evaluate the effectiveness, accessibility, and quality of personal and population-based health services. And number 10 is to conduct research for new insights and innovative solutions to health problems. And so those are the 10 essential functions of a public health person. Next slide, please. And so what is dental public health? And this specifically is trying to link the relationship between dentistry as a profession and core public health functions. And so the American Board of Dental Public Health defines dental public health as the science and art of preventing and controlling dental diseases and promoting dental health through organized community efforts. And so if you think about it, it's really trying to, rather than seeing your patient as an individual, you see the community or the population as your patient. Next slide, please. All right, and so for the DPH specialist, there are 10 competencies that have been outlined by the American Board of Dental Public Health. And so throughout your residency training, these are the things that we try to imbibe in you. And so the first is learning how to manage oral health programs for population health. Second is demonstrating ethical decision-making in the practice of dental public health, evaluating systems of care that impact oral health, designing surveillance systems to measure oral health status and its determinants, learning how to communicate on oral and public health issues, leading collaborations on oral and public health issues, advocating for public health policy, legislation, and regulations, appraising the literature, so critically appraising the evidence to address oral health issues for individuals and populations, conducting research to address oral health and public health problems. And the last thing is to integrate the social determinants of health into public health, dental public health practice. And these competencies were last published in 2016, and they're really designed to show you the skills that a dental public health specialist is supposed to possess. And I have the citation right there at the bottom, if you want to read more about each of them. Next slide. Right, and so just like I said at the beginning, if you think about it, the patient is the individual is your patient in the clinic, but as a DPH specialist, the population is your patient. And so the focus is really on the community and the demographic characteristics rather than, the symptoms and the signs for each of the patients that you see in the dental chair. But as a clinician, you conduct exams, but as a DPH specialist, you really plan surveillance systems and you try to collect data about the population, about the epidemiology of disease, the distribution of diseases at the population level. And so whereas the clinician tries to establish a diagnosis, as a public health specialist, you're using this data that you collect through the surveillance systems and through all the various data sources to create a plan or an intervention for the community. And you try to conduct a needs assessment to understand what it is that is going on in the community. And once you understand these issues, you try to engage community partners in your solutions, and you work with them to implement these programs. As you implement these programs, you make sure that you're documenting them, and so you can evaluate them at the end of the programs. Next slide. All right, and this slide just really gives you some examples of where DPH specialists work. As you've heard from our recent graduates and alumni, there's a range, there's a host of opportunities for dental public health residents to work. And it's really up to you to carve out what you want to do with your certificate. Public health is broad, as you can imagine. And so there really different ways in which you can utilize the skills that you acquire during your residency program. We put some examples here. So for example, you can work with federal agencies, state and local public health departments. If you were part of the military, you can work with them. Some people also choose to just work in clinical practice, but serve underserved populations, work with rural populations, disadvantaged populations, or just really clinical practice in any public health setting. So the prisons, for example. And then, you can go into academia, you can choose to focus on research, you can work at the schools of dentistry, schools of public health, schools of dental hygiene. You can even be part of school-based programs. You can also go into private consulting or work for nonprofits like Dr. Amanzadeh is doing right now. You can decide to focus on health policy and work with policy institutes, research think tanks, ADIA, and really think about how to shape the oral health policies for the future. All right, next slide. Okay, so we have a question here. I can see that the chat is bubbling. So can you put in the chat again what excites you about the UCSF DPH program? Because I'm sure you wouldn't be here if you're not interested in the DPH program. So let us know what it is that has attracted you to the UCSF DPH program. And I think we can go to the next slide while they're putting that in. Okay, so while you're putting that in the chat, I think we'll just go around and try to get reflections from our recent graduates and alumni about their experiences.
Great, thank you, Dr. Obadan-Udoh. So we have some questions prepared. So our first question, why did you go into dental public health as a specialty? So Dr. Bhavana, would you like to answer first?
I can take this.
Yeah.
Okay.
So as I mentioned earlier, that I work with local oral health coalition right now, but my roots came from 2016. So I completed my dental training in 2016 from North India. And during my rotation in the public health department, I actually had my first experience with research and publication process. And then after graduation, I started practicing in both private and government setup, and that too just for 1 year. But I noticed that I was happier when I was in the community settings, trying to engage with underprivileged and vulnerable populations, as many of you have noticed, written in the chat, that you've had experiences with underserved population. And I was the same. So I was like, come on, this is where someone like me can contribute to improving public health. And I found about the joint UC Berkeley MPH and UCSF dental public health program from one of my professors in India. And trust me, applying to the program was one of the best decisions in my life. And this journey was not at all easy, but it was very much rewarding. And I really feel honored to be one of the the first cohort students in this program. And at that time, it was like uncharted territory for everyone, like for students and applicants, faculty and administrators. But now the process is very smooth. And I would recommend, like, to those who don't have MPH experience, to apply for this program and actually enjoy this process from the best schools in the States and faculty in the United States. That was my story.
Okay, I can go after. Thank you.
Wonderful,
Karen.
thank you.
So I'm originally from Iran. I work as a dentist and faculty for over 20 years. And when I was working in my country, I focused on preventive dentistry, community dentistry, and oral health literacy. I try to improve dental health literacy of my patients. But at some point, I realized that it's not enough for me. So career-wise, I was thinking that I want to go beyond. I want to work on community and policy level in addition to individual level. And so when I moved to US, which was part of our family plan for higher quality of life, I also used the opportunity to pursue my career plans and personal development and my interests. So I was really interested in preventive dentistry, reducing dental caries in the community. I was interested in community dentistry, and when I was in dental public health program, I was exposed to various topics that maybe I was not exposed when I was in my country. So oral health disparities, learning health system, strategic plans to improve oral health in the community and policy level. These were, my new field of study. Recently, I developed interest for dental informatics, natural language processing, data science, and to incorporate them in dentistry and dental public health plans and research, and also conducting interdisciplinary research studies. Going to a postdoctoral program, which at the time after I graduated from DPH program, this opportunity came up, and I started my postdoc for 3 years. This is my third year. So it opened a world of opportunities and educational opportunities for me, and also for research. And I am sure if you apply to this program, you will be really opened up or exposed to a lot of opportunities, educational research, and community dentistry. Thank you.
Thank you.
I can add to that. Hello, everyone. I got my U.S. dental license in year 2002, and I was working as a clinical dentist, and then I started to kind of get into the kind of clinical faculty positions at another university of the Pacific, and I started to kind of observe different settings, clinical settings I was working in, and kind of like community settings was different, and quality of care was different. And so I took a research training at University of Washington on clinical research, and it really opened my eyes to the field of public health. And then I went to UC Berkeley and I got my MPH, and then I was like, I'm actually going to put dentistry aside. I'm going to get into global health. I was done to actually go other route. And then I got to kind of learn about the Can Do Center, which you will learn more about, which is like a research center, very kind of robust NIH funded research center focusing on children's oral health disparities at UCSF. And at that time, I talked to Jen Weintraub, and I was like, wow, this is amazing. This is another level of like understanding of what this field is. So I went to the PhD residency program, and And one thing that I wanted to share with you at that time, so I am a grad of 2011. At that time, Dr. Silverstein, who was my mentor, once in one of our trips, we would go to this trip to Sacramento, that we would kind of like be in some of the governmental meetings. And I was like, what am I going to do afterwards? And I remember he told me, in this field, it isn't going to show up to you little by little. Just like focus on what you're interested on and really invest yourself in it. And that has been really the story of my career. During my residency, I was exposed to community oral health programs. I'm really kind of like wanted to bring my research kind of into that. And school oral health programs, I was involved in a grant in Oakland. I was doing qualitative research. I was working with an anthropologist, which is kind of like a little outside of like a lot of, I was supposed to do biostatistics. I was like, I'm more into that, and did some global health work around soda consumptions and advertisements around that. And I started working with some nonprofit promotora works around community-based education and care coordination. And it's so interesting that after all of these years, last 10 years, the setting of my work has changed. I have worked in academia. I have worked in government as a county dental health administrator. And now I do consulting work. And I also work with UCSF with some work that they do with counties. But the areas that I have explored during my residency and amazing people that exposed me to those areas, they still stay the same as part of like the areas of my focus. So happy to be here and open to any questions that anybody would have about anything I could be helpful of around career paths.
Thank you. And also thank you for putting your information into the chat. It's wonderful to get to know you and your interest in the profession and also UCSF. So thank you. I see those are still coming in. We do have another question for our alumni and resident here. How the program helped you achieve your goals. So we have Dr. Patel.
I can take this one. So as you all know, I'm a recent graduate of Dental Public Health Residency program, but my interest in public health started when I was in a dental school, where participating in all community health events and public health programs actually showed to me how, as a dental professional, I could make an impact on oral health of underserved and rural population. And one of the primary roles being a public health dentist is also to address population with access to care, workforce, and also spread awareness about how oral health is important for the overall health. And back then, I was, after I graduated my dental school, I started practicing as a dentist, but I really enjoyed this role where my patient is not only an individual, but it was the whole community. And also with dental public health, career diversity is one of the biggest advantage, where you can work in several positions where you can lead a program in government organization, or you can also work as a full-time academician, or you can work in some of a federal health qualified centers, in local health centers, as well as private practices and hospitals. And also, as Dr. Eni mentioned, that there are so many federal and state organizations which are doing some amazing work to make an impact on people's life. And while I was doing my residency, I get to work with UCSF, of course. And as you all know, that UCSF has this HRSA grant, and which is a primary federal agency which is involved in improving access to healthcare services for the people. And also there are a couple of various federal agencies involved. So all these are a few of the greatest career diversity opportunities you'll get in dental public health residency.
Great, thank you. Okay, and then our next question, what is your experience as a dental public health resident? So we have our current resident here, Dr. Magali.
Thank you, Katie. Yeah. So as you know, I'm the only current resident in this meeting, and I'm so happy that like I applied to this program and I got accepted into it, and I feel that was like it was a great opportunity for me. I had the opportunity to work before on dental public health, and I was part of community health needs assessment, evaluation of programs, doing some qualitative research. But I felt like I need to learn, like have that base, strong fundamental of how to do this in a very high quality. So I decided to apply for this program, and I'm so happy that I am in this program. Like UCSF has a great resources, and it's up to the resident actually to utilize those resources. It's up to the resident to get like the opportunity to use all of those opportunities to get engaged and involved in so many areas. In research, it's up to you to do 2 research projects or more, to get involved in so many extracurricular work, and all of this will benefit you and will like make you a stronger graduate from residency. And for me, I had some connections. I'm so fortunate to have before joining this residency. And this residency actually strengthened those connections and opened more connections for me. So this is very important. And it opened the door for so many other projects that I was never gonna be involved in except with this residency. The other thing that I wanted to mention is I'm on the HRSA grant. So I'm a HRSA grant recipient, and this HRSA grant is a federal grant. And I feel that besides like the, and also like it's very important to mention also that this HRSA grant is actually for implementing a program in a rural school in California here in Tuolumne County. So it's like away from me by 2.5 hours. I need to go there like at least once a month, and the grant is supporting this accommodation and lodging. But beside that, and the most important thing that grant is offering for me is to be like to sit at the same table of managing this grant, like to see how like the faculty, all the partners that are engaged in this grant and involved in this grant, having those decisions are taken and managing this grant, dealing with like any glitches that may happen, how we all brainstorm how to deal with that, how to solve that, how to evaluate. So this is a very important opportunity for me to be on this grant.
Great, thank you. As you're hearing from a lot of the shares, California is really unique in that we have a very close partnership with the Office of Oral Health. So there's a lot of opportunities for residents to work locally with the counties and cities. So if that's something that you're interested in program development, there's a lot of opportunities. All right, so next we're going to go into the application process, because of course we would love you all to apply after hearing our stories. So Dr. Obadan-Udoh, if I will bring up the slides.
All right, so you probably all know that we do have a program webpage, but if you did not, that is the link to our program webpage. And we've put some time into updating the webpage. So please kindly review the materials on the webpage. We have all the information for the admissions. We have a frequently asked questions section, FAQs, that really tries to address all of the questions that you might potentially have as a prospective candidate. And if we do not answer any of the questions that you have, then you can email me and I'll do my best to respond as promptly as I can. Next slide. Right, but in a nutshell, we do have a 12-month full-time program at UCSF. We also have a partnership with UC Berkeley, University of California, Berkeley, where if you do not have an MPH, you can join the 2-year joint program. It's a 2-year track. You get an MPH in the first year, and you're automatically accepted into the UCSF DPH certificate program in your second year. So we do joint applications or joint admissions at the beginning of your first year, so that once you get accepted at UC Berkeley, you get a conditional acceptance into UCSF. And when you complete your MPH program, you can transition immediately into the UCSF program without having to apply. But if you already have an MPH, then you can apply directly to the UCSF DPH certificate program. And I'll go into the application process in the next slide. Oh, no, okay. Well, this is the program structure. Okay, so I wanted to cover this before going into the application process. So there are 3 main things that the students do during their program. The first is you just take courses, and we try to offer courses in general public health. We also offer specific courses in dental public health. And I see that we have 2 of our faculty members, Dr. Pollock and Dr. Taylor, here with us. And they'll be happy to also respond to any questions that you might have. But you get to interact with various faculty members in the Division of Oral Epidemiology and Dental Public Health. And you get to work with those faculty members as part of your research as well. And so students are required to complete a major and minor project, a major research project, and now the minor project tends to be administrative or community-based. Recently, we introduced quality improvement into our lineup of courses, and so you can work on a quality improvement project. You can also work on a community school-based program project. Some students in the past have done program evaluations. So as long as it's community-based, it would qualify as your minor project. And then the field site experience is what Prashanta and Hayam have referred to. The field site experience is designed to get you into the community. And so you get to work with local oral health programs, you get to work with the state oral health program, you get to really provide hands-on technical assistance to these programs and learn how to lead and organize these programs in the community. You also get to work with federally qualified health centers as part of our HRSA grant on quality improvement and medical dental integration. Next slide, please. And this is a nutshell or summary of the recent objectives that we have as part of the new HRSA grant that we got. A HRSA grant is called the Open Smiles Collaborative. And we have 5 main goals. The first is to increase cross-learning between dental public health and pediatric dentistry. And so this is a collaboration between the pediatric dental faculty and the dental public health faculty. And the residents in both programs get to take classes together. The dental public health residents get exposed to pediatric dentistry that is relevant to the public health setting, and the pediatric dental residents get exposed to dental public health and get to learn how to develop a public health mindset and to think about, the public health things, topics, social determinants of health, and all the other things that are related to public health when they see patients in front of them. The next goal is to enhance the delivery of care in federally qualified health centers, and that's what I talked about in the field site. So you get posted to a federally qualified health center, and there you get to work on quality improvement, you get to work on medical dental integration, and the pediatric dental residents get to provide clinical care in those settings as well. And the third goal is to immerse residents in rural communities. And so we talked about, serving underserved populations, working with disadvantaged populations. So we do get to post you to rural counties so you can work with local oral health programs. As part of this work, we're implementing a virtual dental home or a school-based telehealth program. And both the pediatric residents and the dental public health residents get to work on this program together. And then the fourth thing is to expand the opportunities for dual specialization. And so the goal, or the overarching goal, is to encourage, cross-specialization, or at least at a minimum cross-learning and an understanding of what the other specialty does. And so the pediatric residents get to do an MPH degree, and the dental public health residents, if interested in pediatric dentistry, can also do a specialty residency training in pediatric dentistry. Although right now this is limited to US trained dentists. And then the last goal is implementing a telehealth program for kids with special needs, specifically autism and neurodevelopmental disorders. So we have a special autism clinic that both pediatric dental residents and dental public health residents can attend. And this clinic is really geared towards desensitization and getting the kids comfortable with attending receiving dental care in a pediatric dental office. Next slide. So we have a website. It's called opensmiles.ucsf.edu. If you want to learn more about these programs and the cross-training between pediatric dentistry and dental public health, you can learn more at the website. Next slide. Okay. Right, and so tuition, as at the last check, if you're a California resident, you pay about $23,000. If you're a non-resident, you pay about $38,000. Typically, this is decided by tax payment, and so you can find more information on the UCSF website, the registrar's office. But essentially, you need to have lived, I think, in California for a year to qualify as a California resident. We do have funding, and so there's funding through the HRSA grant. If you're a US citizen or permanent resident, you can get up to $35,000 to offset the cost of tuition and any other cost. If you're also a recipient of the HRSA funding, you get all your travel costs reimbursed when you go to the rural communities. As part of our partnership with the State Office of Oral Health, we do receive funding for people who are non-US citizens or non-permanent residents. And so you can still get your travel covered to the rural communities or to your field site, as well as some form of stipend or tuition. The amount is variable and it depends on the funding year by year. So we cannot give you a specific amount. It has been as high as $12,000 and as low as $1,700. So it depends on the year and the budget for the year, as you can imagine. But there is financial aid, and so you can reach out to the Office of Financial Aid to apply for scholarships or discuss your options. Next slide. Right, so how to apply? We use the ADIA Pass system, and the applications typically open in May. We close on February 1st. It's pretty much a hard deadline. And so if you plan to submit an application for the next cycle, the next academic year, which begins July 1st of 2022, then you need to turn in your application by February 1st. There is a supplemental or application processing fee that's due to the university by February 10th. So after you submit your application to pass, please reach out to the UCSF Postgraduate Admissions Office to complete the supplemental application by February 10th. The earlier you complete your application, the better, because if there's anything missing or if your application is incomplete, you have some time to turn things around before the deadline. All interviews tend to be conducted at the end of February or beginning of March, and we make decisions in March, so you would hear from us one way or the other by the end of March or beginning of April. Next slide. And these are just the things. So once you complete the ADIA Pass application form, we require, these are the requirements. You require a DDS degree or equivalent, and an MPH degree or equivalent. So what we mean by equivalent is if you have a master's degree, for example, in healthcare administration or epidemiology, you can still apply even if you do not have an MPH. But what we look for are 5 core courses that are covered. And if those courses are not covered, we would ask you to take supplemental courses to make up the difference. And if you have a DDS degree or an equivalent degree like a BDS, then you're also welcome to apply. The application usually involves a personal statement and the submission of your transcripts. If your transcripts are from a foreign institution, they would need to be evaluated by WES or ECE. And then we also require a CV and 3 letters of recommendation, as well as a dean's evaluation. If you have not had up to 1 year of education in the United States, we usually require that you submit your TOEFL scores. Next slide. All right, that's it. So feel free to pop in questions about the application process in the chat, and I think we'll do our best to respond to that. But now it's open for discussion. So any questions you have, you can ask.
Wonderful. And then we've had some questions that have been submitted, so we can start with those. So a question from the audience is, what are the activities that a dental public health resident is engaged in during the course? So which presenter, alum or resident would like to speak to that?
I can try that. My information again is from 10 years ago, but just to give you like the scope of this residency. When I was a resident, I was involved in the work of the CAN-Do, so research and just being exposed to the conversations that goes around grant management and different programs at Health Force Center. So, so kind of just being exposed to all of that. And also I was involved in kind of teaching in kind of some of the courses. I know at that time tobacco cessation was one of the courses I was helping in. And when it comes to kind of community-based work, I got exposed to working for the Center of Community Engagement, and from there kind of like looking into how to involve oral health into other areas of community engagement. But again, there's a lot of possibilities, right? But I think these days, just looking at California and where California is, as you heard, a state Department of Public Health has a very active Office of Oral Health. And that has happened in the last few years because of the funding of tobacco tax money. So there's funding in California, and usually in public health, when there's funding, infrastructure gets built around it. And we have a very robust leadership from Dr. Jay Kumar at California. So, I mean, as a consultant, one of the reasons that I have been able to actually build the consulting work is because all of the local jurisdictions in different counties are receiving that money to build, to do needs assessment at the local level around oral health, to do a strategic planning and kind of invest in planning programs, especially around the school oral health programs and other areas like medical dental integration. So as a resident, I think it's a very unique opportunity because not only you get to be exposed to the academic strength of UCSF, but there is this community-based governmental activities, both at the community-based planning, policy advocacy, all of that going on. So there's opportunities to kind of tap into that depending on the interest and the and also capabilities of the resident and which areas they want to work in. Yes, so there's a lot of opportunities.
Thank you. Some great examples. We can also go to the chat. Thank you for putting your questions in there. We have a question from Anna. Is the program online? Is it online or is it a hybrid program?
Right. Okay, well, in normal times, it is an in-person program. It is a full-time in-person program, but due to the pandemic, we've had to modify things. And so right now it's a hybrid program. So most of the seminars and lectures occur through Zoom. but then the field site experience still occurs in person. Although some public health departments are focused on COVID, and so you might not be physically present there, even if you're working with them, most of them are working from home, and so you'd have to work with them, remotely. Some programs are open, and so if your program is open, then you get to work with them in person. I think you're mute, so I can't hear you.
Thank you.
All right.
Which is also a silver lining. We've been able to do a lot more things on a broader scale, but it is nice to be in person. We have another question from Lauren. Is it possible to have clinical rotations during the program if you have a California license?
Oh, that's interesting. When you say clinical rotations, do you mean as part of the residency program, or can you work clinically, on your own? What are you referring to?
I found that some of the other dental public health programs, you actually can go in and practice as a clinician while you're also completing the programs, and it's part of the program, and it's something they can allow you to do.
Right. Okay. Yeah. So in the past, we haven't had any residents practice clinically, but like I said, we just started the partnerships with the federally qualified health centers. And so if you do have a California license, you can potentially work with the school-based programs and deliver some care through the school-based programs. But for you to work as part of the program, you would need faculty supervision. And that's usually where the conundrum occurs, because there's no faculty supervision offsite. There's no clinical rotation on campus. So you don't get to practice, at the dental clinics, for example. But we do have the pediatric dental course, where you are in the pediatric dental clinic and you're being supervised by the pediatric dental faculty, but all of that is training. It's not independent practice. Okay. And we can talk more about that if you want to create something, if you already have a California license, and what opportunities we can create for you.
Thank you.
Okay, thank you. And then added to the chat was the work that Dr. Amanzadeh was talking about with the California Oral Health Technical Assistance Center. You can look at their website. All right, another question that came in: what does a typical day in the life of a resident look like? And I think Chaim is unmuting herself. Thank you. Thank you, Dr. McGowan.
I can't take that fresh in my mind. I'm still, yeah, I can give you a quick experience of my daily life now. I would say that the program is a full time. So you're expected to work or to be available from 8 to 5, which is like, it depends on you, how you want to spend your day. But basically there are 2 days or up to 3 days a week. There are lectures, there are meetings, there are courses that you are part of the residency program. Aside that, there are going to be your own projects that you're going to be working on, which, like, it's up to you, but at least 2 research projects. And with that, you will need to meet with your mentors from the UCSF faculty. And this is like amazing, because this is an opportunity that's you need to utilize the best you can. So you meet with them, you work on your research projects. Other than that, you will, if you're involved in an FQHC or in rural school, program that I'm involved in, you will go. For me, I go at least once a month to Lamni County, which is actually, in the beginning, I thought it's going to be so hard, but after going like 1 time, 2 times, I found that it's really, I learn a lot when I go there. I get exposed to a community in rural area, seeing the kids at the school, being involved in the dental screening for those kids, and seeing this that's there. It's really, when I got involved in this dental screening, I felt the need for such a program to be there. It's not just grant money that are implementing a program. There is a real need there. So I feel like I'm gaining a lot of experience. Other than that, you will need to study for the board exam, which is going to be the written exam in March for next year. So this is also part of my day. Other than that, it's going to be like, it depends on the work that's going to be involved in. You can get involved in so many other projects or programs or work. For example, like I will give you just an example. Dr. Eni had shared with us an opportunity to review abstract for the National Oral Health Conference, for example. This is a great opportunity and a great experience to see what are the current research interest in the oral health arena. So these kinds of opportunities, it's up to you to utilize them all. It's up to you to learn the best that you can.
Thank you. As you can see, there's a variety of things that you can do, activities. Our next question is, do residents have opportunities to teach current dental students?
I can take this one. So I would say yes, residents have many opportunities to teach current students, and UCSF has a well-established interprofessional education curriculum. And as a resident, you can volunteer for the IP sessions, which I believe happens twice a year in spring and fall. So you can participate in that and also like teach students on the standardized patient cases, which is an interesting exercise. So I started teaching in 2019 as a resident, and I'm still doing it and I'm loving it. So basically the volunteer facilitator gets 1 hour of orientation, and they also get the material or guide to use. And the learners of this sessions, they comprise of first and second year dental students, from students from School of Medicine, nursing, pharmacy, physical therapy. And also if you're interested in teaching, so there are like many pedagogy workshops and even like workshops on clinical teaching, IPE. You can attend that as a resident or a faculty member. So not mandatory, but great opportunities to advance your career in teaching. And currently, like I'm also serving a committee member in 2 committees of this interprofessional curriculum. So my experience so far is being like amazing with the interprofessional committee. And I know like there are some other opportunities at School of Dentistry, like you can volunteer in teaching dental students in the community health program. So you can go to the school districts with some faculty, and you can do like the supervision work while the dental students, they are actually doing screening and patient education. So those are additional opportunities for teaching.
Great, thank you. And then one more question. Can you share more information about the UC HBCU Scholars Program?
Right. So I'm going to do my best, but I will point you to Dr. Anne Lazar, who is the UCSF lead for the UC HBCU program. But essentially, it's a program that tries to connect students from HBCUs to UCSF or to the UC system in general, not just UCSF. So I think all UC schools, but in particular UCSF, it's tied to the Can-Do Center, which is the Center for Oral Health Disparities. And so it's a summer program, a summer research program. If you're currently enrolled in an HBCU, you can come to UCSF and do research for an entire summer. And what that does is it exposes you to the faculty, and it creates an opportunity for you to return to UCSF to join any of the graduate programs or a PhD program. I think it's particularly geared towards PhDs, but it would really be favorable for you if you apply to any of the UCSF programs. I think it also guarantees funding for the PhD program. So 3 to 5 years of funding if you are if you are a product of the summer research program. Does that answer your question? Do you want to know anything more?
I think we're good. Thank you. And then we'll have a slide of contact information at the end. So if you have more questions, please reach out. I know we didn't get to all the questions, but we can follow up with the audience. But just real quick, 2 more questions before we go to the slides again. Dr. Obadan-Udoh, can you speak a little bit to, there are courses offered at Berkeley, but can you take those courses on campus as a DPH resident? Is that kind of what you're asking, Lauren?
Sorry.
So as a dental public health resident, can you take courses at UC Berkeley?
Yes, you can. I don't think they're not all free. If you want to audit them, that's a different question. But if you want to take them for credit, or if you want them to be part of your transcript, then I think it varies. But you can take courses across UCSF. There's a course catalog which we can share with you, where you can look at courses. But you technically can take courses at UC Berkeley. The requirements just vary from course to course. So you would have to reach out to the specific instructor to see if they would let you audit the course. So if you want to take it for credit, you know what that means.
Thank you. And thank you, Dr. Bonava, for the message in the chat. All right, the next question in the chat is, how many residents are accepted per year?
Right now, we are approved for 4 residents per year. We're hoping to increase to 6. But yeah, 4 residents per year.
Great. Which leads us to a poll question. We would love to hear from you. When are you thinking of applying? Well, if you're interested in applying. So if you guys are on your computers and you could fill out the poll.
I think the poll question is different from what we have on the screen.
Oh, that's not great. How likely are you to apply to the UCSF DPH postgraduate program? I think the slides got mixed.
Okay, all right.
All right, you see a little flurry of movement. I'll go ahead and close the poll. All right. Thank you so much.
All right.
Okay. And then we have some resource references and resources. These are most of the books and the associations that support dental public health as a specialty. And our contact information. So please reach out to us. We do have a Twitter handle. These are the two web pages, the Dental Public Health Program and the Open Smiles. We have one more poll that I would like to launch. If I can just stop sharing. Our second polling question, we would just like to know a little bit as we're ending today, when would you like to apply? So is it for the upcoming application period, the next one within the next 4 years, you're not sure, you would like more information? We would just like to get to know you, just so this is the first time we're doing this info session, so we can kind of tailor it in the future. And also we do have mentors. We do have some of our faculty on the webinar today, and we would like to match up anyone who's interested in learning more about the dental public health specialty. Thank you. I'll go ahead and end that poll and then share the results with everyone. Great. So it looks like you're interested in applying this year, next year. So it looks like we're really building out a pipeline of dental public health specialists here. Stop sharing this. And thank you so much for attending. Dr. Obadan-Udoh, any last minute closing remarks?
No, but thank you all. Howard, do you have any remarks? Howard was our previous program director for the UCSF residency program.
Well, I've enjoyed a wonderful career in dental public health. And the program, you know, I modestly say, under my directorship, enhanced what was previously under Dr. Silverstein's directorship. And if you can improve on any of that, Eni has. In getting the grant from HRSA to support the activities and expand the opportunities. And I just want to say it's the career in dental public health provides you with a variety of things. So you don't get stuck in four walls, and you get out and about into the community, and you can still practice dentistry if you have a license. So all of that is just, it's just a great opportunity.
All right, thank you. Thank you all for attending. We'll be in touch, but feel free to reach out to us if you have any questions.
Thank you. Thank you so much to our presenters. Thank you all for attending today, and we look forward to hearing from you.
Thank you.
Thank you.
Bye, everyone. Thank you.
Bye.
Yay. Bye. Thank you so much. Oh.